Namaste, myself Bharati Allumalla. I'm a housewife. Today I am in Motherhood Hospital to discuss few women-oriented problems with our great Dr. Mutya Latha Koppula. She is an obstetrician and gynecologist in Motherhood Hospital, Hebbal. Hello, ma'am.
Hello, Bharti.
And she takes care of all obstetrics, gynecology, and laparoscopic gynec surgery, fertility, IVF. She has 18 years experience in high risks of obstetrics, laparoscopic surgeries, and infertility management. She gained vast experience and is an expertise in conducting normal vaginal deliveries, instrumental vaginal deliveries, cesarean sections, major and minor gynecological surgeries like uterus removal, fibroid removal, ovarian cyst removal, surgery for ectopic pregnancies, family planning surgeries, etc., by both open and laparoscopic methods. Hello, ma'am. Welcome.
Hello, Bharti. Hello, all of you. And thank you, Bharti, for a very nice introduction. I'm very happy for having this opportunity to sit here and discuss with you. So let's start the topic.
As you know, today most of us are facing with abnormal uterine bleeding.
Yeah. Okay.
So I want to ask few questions on this topic. What is abnormal uterine bleeding actually?
Okay, Bharti. So any variation in your normal menstruation pattern, we call it as abnormal uterine bleeding. Okay, so most of us have a normal menstrual cycles occurring at 21 to 35 days, and usually a woman bleeds for around 2 to 7 days, and the blood loss usually approximately like 20 to 80 ml, and she doesn't have any pain or very minimal pain on the first 2 days of menstruation. So this is how a normal menstruation looks. But any like how we said, if there is any variation in the normal menstruation pattern, like suppose in the frequency of menstrual cycles, if the cycles are more frequent than 35 days, or if they're less than 21 days, or if she's having a blood loss of more than 80 ml in each cycle. So because we don't measure the blood loss at each menstruation, usually we measure this blood loss in the by telling the frequency of sanitary pad usage, or any amount of clots. If she's passing large or medium sized clots, we say it is excessive blood loss. Or at the same time, if the patient is changing pad every hour, that is also excessive blood loss. Or the duration of blood loss, if the blood loss exceeds more than 7 days to 1 week, 7 days or 10 days, this is also excessive blood loss. So apart from these variations in the menstruation pattern, if a woman experiences slight spotting before menstruation or after menstruation, that is premenstrual or postmenstrual spotting we call it as, or bleeding or spotting in between your menstruation, that is called as intermenstrual bleeding, or bleeding after coitus, it is called as postcoital bleeding, or bleeding during after menopause, this is called as postmenopausal bleeding. These all types of bleeding also we categorize under abnormal uterine bleeding.
Okay.
So these variations women need to know if she needs to consult a doctor.
Okay. So how can it will be like? How can we notice that it is a uterine abnormal uterine bleeding, and which age groups we can identify this?
Okay, how can so you mean to ask how a woman identifies it if she's having an abnormal uterine bleeding?
Yes.
If we take the literature on, according to studies, so 35 to 40% of women worldwide will experience this abnormal uterine bleeding. But these studies may not be very correct, because not every patient with abnormal uterine bleeding report their symptoms. So that is the main problem, because every woman who have symptoms, they live with these symptoms. They start living with these symptoms, thinking that most of them think that these symptoms are normal for them. Okay, so, but according to experience or practically speaking, every woman once in her lifetime experiences this abnormal uterine bleeding. And coming to the age group, so you have asked about the age group. So, abnormal uterine bleeding can be experienced by any age group women, but most commonly it is seen at the start of the cycle, that is at puberty, and at the ending of the cycle, that is during this perimenopausal transition or postmenopause. So, these are the most common age groups which people experience abnormal menstruation.
How will the woman come to know this abnormal uterine bleeding is happening? How can she identify?
So, okay, you mean to say how she recognizes that if she is having an abnormal
Yes,
uterine
ma'am.
bleeding? Okay, so this is a very good question, Bharati. So, what happens is when it comes to menstrual cycles, there is a wide range of normal. So, not everybody's menstruation is like a regular pattern. Okay, every woman, so she is a better judge of what is normal for her. She has to recognize what is normal and what is abnormal for her. So as long as your periods are following a regular rhythmic pattern and it does not cause any problem for you, it is okay. But if your periods become unpredictable, that means you do not know when your periods are happening, you do not know how many days your flow lasts, or you do not know when the period stops, and it's affecting your day-to-day activities, then this is abnormal bleeding. Okay, then you might be having some medical condition which should be treated. So immediate attention is needed in these type of patients.
Okay, but present no ma'am, few people like few ladies who has crossed 35, 40, when they are going through this, few doctors are saying that it's a menopause stage.
Okay.
So is it correct? Is it menopause or is it abnormal uterine bleeding?
Um, Usually 35 to 40 years is not the age group where patients attain menopause. Okay, usually it's slightly elderly age group. After 42, 45 years only, we say it is perimenopausal transition. So this transition usually is 1 to 5 years before the actual menopause. So 35 to 40 years, the patient might be suffering from some other cause. There are plenty of causes which can cause abnormal uterine bleeding. So this usually is not menopause. If menopause is occurring at this age group, that it is premature menopause. So that also need to be evaluated.
Evaluated.
Yes.
Okay. What is the effect of AUB in women's health? Abnormal uterine bleeding in women's health?
Previously, as I said, not every patient reports their symptoms. So they start living with these symptoms. So we see in our hospital, we see patients they're bleeding profusely for 1 to 2 years, and by the time they come to us, they're already their hemoglobin is reduced to 5, 6 grams. So this awareness should come among women. So what impact does it have on women's life if a woman bleeds profusely, or if a woman has more frequent cycles, if she's bleeding, if she's getting menstrual cycles more frequently, or if she's having prolonged cycles. So these the women has more blood loss every cycle, and they tend to become weak. So over a period of time, they become anemic, and sometimes they need blood transfusions also. This can be avoided with early checkups and early consultation with a doctor. Second thing is, most of the abnormal uterine bleeding causes would be due to hormonal issues. And if a woman is in reproductive age group and she is trying to conceive, so these hormonal changes may sometimes delay her conception. So that is the reason they need to have an early checkups in these type of patients also. And most importantly, if a woman suffers from abnormal uterine bleeding and she's in elderly age group, about 30, above 50 years of age group, so these patients might be suffering from some cancers of the genital tract, like uterine cancers, cervical cancers, or any other cancers of the genital tract. So again, these cancers of the genital tract, they need early evaluation and treatment so that we can improve the survival rates in these patients. So definitely there is an impact on women's health. They have to report to the doctor early and get adequate treatment.
What are the causes for abnormal uterine bleeding?
Again, the most common reason would be hormonal issues. Any age group, hormonal disorder is the most important reason why the woman experiences this abnormal uterine bleeding. Again, as I said, at puberty and during menopausal age group, hormonal issues are there. At puberty, because there is immaturity of the menstrual axis. So in our body, there is an axis which relates our menstruation to the brain. So this axis is called as hypothalamic pituitary ovarian axis. So this axis is not mature in pubertal groups, pubertal age group people. So that is the reason they have these anovulatory cycles and they experience abnormal menstruation. And similarly, at the age of menopause, there is declining ovarian function. Because of this declining ovarian function, again they have anovulatory cycles. Because of this anovulation also, they experience abnormal menstruation. Apart from this, in reproductive age group, that is patients who are in the reproductive age group, there are some phases in her life where she experiences these hormonal changes, like post delivery, post abortion, or during breastfeeding also. They can have hormonal changes which can cause this abnormal menstruation. So apart from this, some hormonal disorders like thyroid disorders, polycystic ovarian syndrome, or any prolactin disorders also can cause hormonal issues. And the second important reason is organic pelvic pathology. That means these patients, some patients might have some pelvic lesions inside, which are causing this abnormal menstruation. Pelvic lesions in the sense they may be having fibroids inside the uterus, polyps. You might have heard of these things. So polyps and fibroids, they're benign growths from the uterus. They're not cancerous, slow growing lesions, but they stay there and they cause this abnormal menstruation. And one more organic lesion that is called as adenomyosis. So what happens in adenomyosis? Usually this is seen in after the age group of 40 years. So during menstruation, we see that menstrual blood is coming out. So instead of the menstrual blood also seeps into the layers of the uterus. So some amount of blood loss is seen through the vagina, some amount of blood seeps into the endometrium, and blood seeps into the layers of the uterus. So at each menstruation, what happens? The uterus starts enlarging itself. So these patients experience a lot of pain during menstruation and they have excessive bleeding. So when we do a pelvic examination and when we do a scan, when we see a lot of pain, excessive blood loss, and we see an enlarged uterus, it is mostly conclusive of adenomyosis.
Okay.
So this is one important organic lesion which we are seeing in our patients these days. And next important reason would be medications. Some patients knowingly, unknowingly, they are on this ecosprin, blood thinners. So maybe due to heart problems or to any other reasons, if they are on ecosprin, they can have this abnormal menstruation. And hormonal pills. If they are on prolonged usage of OC pills or any other hormonal pills, or if they are improperly using this, not following the doctor's advice, they are improperly using these hormonal pills, they can have abnormal menstruation. And nowadays we see young girls taking these eye pills very frequently, so that can be a cause of abnormal menstruation.
Okay.
So I would advise every young girls not to take these eye pills because they're very high dose pills. They're not indicated in every circumstance, so should not be used very frequently. And also postponement and preponement, there is liberal use of
Yeah.
preponement and postponement pills. Once they give the prescription, some people have a tendency of using these pills every month. So this also should not be the reason. They are all hormonal pills, they can change your menstrual pattern. And the next important reason would be coagulation disorders. So this coagulation disorders, we diagnose it in a very early life, like in pubertal age group. If a girl comes with excessive bleeding, some of these girls will have deficiencies in the clotting factors. So when they have the deficiencies in the clotting factors, the blood does not clot and they have excessive bleeding PV. So one important reason for abnormal menstruation. And then infections of the genital tract, again an important reason. And the last but not the least, cancers of the genital tract. Abnormal menstruation in the elderly age group have to be evaluated for these cancers of the genital tract.
Okay.
So some of the reasons, Bharti, but important reasons.
Important
Yeah,
reasons.
important.
How we diagnose this AUB, abnormal uterine bleeding, and what investigation would you be prescribed?
So when a woman arrives with abnormal menstruation, so first thing, history is important. Like as I said, we have to rule out any medication history, any stress history. We have to rule out some hormonal issues from the history itself. We can say it is a hormonal
Okay.
issue. So history is important. Next important thing is pelvic examination. So this one important thing I want to stress. Many of the patients think directly once they come to the clinic, they think scan is enough or they go for investigations only. But pelvic examination is one important thing. Even before we advise an ultrasound, has to be done for every patient with any gynecological issue, not only abnormal menstruation. So what we come to know with this pelvic examination is we come to know the lower genital tract. How is the vagina? How is cervix is looking? So any issues over there. And then when you do a bimanual examination at the same time of pelvic examination, we come to know about the size of your uterus and any adnexal lesions. That means any problem in your ovaries, uterus. So much information we get from this pelvic examination. So this is a must for every woman. So pelvic examination, when coming to abnormal menstruation, we can find out fibroids sometimes, enlarged uterus like how I said in adenomyosis. Sometimes we see small polyps hanging out of the cervix when we do a per speculum examination, and sometimes infections of the genital tract also can be ruled out when we do this examination. So pelvic examination, one important tool, I won't say it is an investigation, so how we proceed further. One important tool for us in cases of abnormal menstruation. Second thing is first line of investigation would be an ultrasound. It is a pelvic ultrasound or ultrasound abdomen and pelvis. So in this we come to rule out any organic lesions like fibroids, polyps sometimes. Polyps are always not seen on scan. In scan, sometimes they give it as a thickened endometrium. So endometrium is the inner lining of your uterus. So when there are polyps, sometimes scan finding is just a thickened endometrium. So we need to evaluate if it is just only a thickened endometrium or any polyp sitting out there. And adenomyosis also sometimes we get it can be diagnosed by ultrasound. Then apart from these, any simple or complex ovarian cysts which are responsible for this abnormal menstruation also can be ruled out by ultrasound. So, and if in a scan, if we see a thickened endometrium, we want it to further evaluate it, we need to do a hysteroscopy and endometrial biopsy. So, hysteroscopy is an inside evaluation of your uterus. It can be done in an office setup or it can be done under anesthesia as a minor surgical procedure.
Oh.
So, in this what we do is we insert a camera. It's a small 5 mm scope camera inside the uterus, and we examine inside the uterus. As I said, thickened endometrium cannot be made out by scan. Sometimes in thickened endometrium cases, when we do a hysteroscopy, we find out small polyps sitting out there. So in the same sitting, we can remove the polyps, or we can do a gentle curettage to remove the polyps. So hysteroscopy followed by biopsy. So other all investigations like MRI and all are reserved for some advanced, some cancerous cases and all. So these are the normal investigations which we do for us to diagnose abnormal uterine bleeding.
Yeah. Ma'am, as we are discussing, you are saying that history, we have to see the history. It means it's a kind of heredity, which, like, if my mom has this, she gone through this, like, even I will face this.
Okay, Bharti. So this we cannot precise to one cause. As I said, there are some things which run in hereditary, like cancers, they run in hereditary. Uterine cancers, ovarian cancers, they run in families, cervical
Okay.
cancers. So if a patient is giving this history, as I said, history is important. If a patient is giving this history, we advise some tests, extra tests for her. We advise her to go for, if she is giving a history of cervical cancer, definitely pap smear at an early age, and then we ask her to go for HPV vaccination. So HPV vaccination plus pap smear combined will give 99% protection for cervical cancer.
Okay.
So like in the similar way, uterine cancers, and if the patient is giving a history of uterine cancers in her mother or grandmother, and she has similar complaints, then if she is more than 45 years, definitely we won't wait and give conservative management for her. We immediately advise a endometrial biopsy to be on the safer side.
Okay.
Okay, and some other reasons like fibroids can run in families. So apart from that, hormonal issues are in this generation they are more when compared to previous issues. So previous generations. So not all causes we can attribute to hereditary, but yes, some there are some causes which can run in families.
Okay. Ma'am, you are saying how to investigate, you told us,
Mm.
and how to diagnose everything. So, any treatments for this? Like, how many treatment options are there for this
Okay.
abnormal uterine bleeding?
Okay. So there are plenty of treatment options, Bharti. Like again, the treatment it cannot be generalized for every patient in the same way. So because again, the treatment depends upon the age of the patient, what is the cause of her bleeding, is her fertility status complete, etc. So if a patient comes with abnormal uterine bleeding, these all things we see. How many days she is suffering the complaint, what is her age group, if it is only 1 month, and if her investigations are 1 month or it is not very chronic condition, okay, and if her investigations are within normal limits, then we think it is a hormonal issue which is causing her abnormal bleeding. So definitely we offer her a conservative management, that is medical management. Okay, in medical management we have non-hormonal treatment which can stop bleeding, like NSAIDs and fibrinolytics, and all hormonal treatment which can stop your bleeding. So hormones can be again oral estrogen and progesterone combined pills, or only progesterone pills. So when we give hormones externally, what happens is your body hormones they fall to a very low level. In a way, it sets our body hormones. So this is the basic thing what happens when we give hormones to a patient. So for every patient, we try, if the investigations are within normal limits, most of the patients we try with the medical management with these hormones or non-hormones. Suppose in spite of this medical management, if she continues to bleed or she is having persistent bleeding, bleeding is problematic for her, then we go for invasive treatments. Invasive treatments in the sense maybe we advise for a DNC, hysteroscopic guided DNC. As I said, hysteroscopy, we evaluate the uterus in the same sitting, we clean the walls of the uterus. So whatever hormonal issue she is having all these months, the endometrium may not be very clear. It's not a very clear picture. That is the reason she is having this abnormal menstruation pattern. So once we clean with the DNC, she will have a fresh regeneration of the endometrium. Her menstrual cycles may set after DNC. And nowadays we combine hormonal IUD insertion also along with this hysteroscopic DNC. So this is a very effective management which we have not seen in previous days or previous generations. So this hormonal IUD is like a small T-shaped plastic device. So it is similar to copper T, but it is
Okay.
quite different from copper T. Okay, copper T does not have the hormone. This hormonal IUD, this is an intrauterine device which contains a small hormone. Hormone at a very low dosage. So the normal hormonal pills what we take, they contain high dosage when compared to this hormonal IUD. And one more important thing is it releases hormone at a very low concentration and at a steady state. So once the hormonal IUD is inserted, it releases hormone at a very low dosage every day, and in a way it sets your body hormones. And it does not have any systemic side effects like how the oral hormonal pills or any other injections have. So very effective method to control your bleeding, and once it is suiting a particular woman, it can be kept in there for 5 years.
Okay.
So this is one effective treatment for abnormal uterine bleeding. But this hormonal IUD doesn't suit when you have organic lesions, very large fibroids or adenomyosis may not respond, or if the patient is having severe pain. So painful periods also they come down with this hormonal IUD, but the result is only 70 to 75% with pain. If the patient is only having excessive bleeding without any other lesions, then the success rate is 90 to 95% with this IUD. So
Okay.
one very effective treatment. And suppose if other reasons, like if you have fibroids or adenomyosis, as I said, adenomyosis, the best treatment would be surgical removal of the uterus. Okay, fibroids, again, if she completed her fertility, again removal of the uterus. If she didn't complete her family, then we need to remove her fibroids depending upon the size of the fibroids and location.
Okay.
Yeah.
Okay.
Some of the
And one more question, ma'am.
Yeah.
Actually, when our friend circle, we were discussing, like newly married people, if they gone through this abnormal uterine bleeding,
Okay.
after the treatment, till when they can't conceive?
Okay. So again, your question depends upon what treatment we have given.
Okay.
Okay, if they have undergone a medical management, suppose if we are putting her on oral contraceptive pills, for some patients we think we need to put she needs a support for 2 to 3 months. So if she is put on oral contraceptive pills, she cannot conceive because they're contraceptive pills. So after that contraception, immediately she can plan for her pregnancy.
Okay.
Suppose if she has undergone DNC, that also she can plan for pregnancy immediately after DNC. Suppose by any chance if a patient needs fibroid surgical removal, depends upon the type of surgery we have performed, and depending upon the size of the fibroid, and depending upon the type of surgery performed in that fibroid, um, the doctor will advise how much rest she need after the surgery.
Okay.
So because sometimes stitches on the uterus, you may not be allowed to have pregnancy immediately.
Like we are discussing abnormal uterine bleeding, one of our friend, she earlier stage she was not like she was even she get periods, she was not like she was very comfort, like very low bleeding, but from past 6
Very
months
low bleeding in the sense she is not using her pad.
no need, yeah,
Okay, okay,
it's kind of that.
okay,
But from past 6 months, she's having heavy bleeding, and she's facing stomach ache, like vomiting sensation, headache, lower body pains.
okay.
So, is this also related to abnormal uterine bleeding?
Definitely, this is an abnormal uterine bleeding, Bharti. So this heavy bleeding, what you're telling, may be normal bleeding. We don't know. Once I see the patient, we can tell.
Okay.
So either completely not putting a pad is also not normal bleeding, and too much of heavy bleeding with so many symptoms also might not be normal for her. Okay, so both of the times she's suffering from abnormal uterine bleeding, which needs evaluation.
Okay, okay,
Depends upon her age group also. What is her
okay.
age group?
She's like 30 to 40.
No, she needs evaluation.
Evaluation. Okay. Yeah. Thank you. Actually, because from so many days, when I thought I'm meeting you, I'll ask this. Thank you, ma'am. And how can we prevent this?
Okay. So again, many causes of abnormal uterine bleeding we cannot prevent, Bharti, but there are some things, certain conditions, some certain risk factors we can reduce by which we can avoid this abnormal uterine bleeding. Like for example, maintaining a healthy weight can maintain your hormones in balance.
Okay.
So hormonal issues we can control with this. Okay, and again, taking certain diets which are very not very high in animal fat. So diets which are high in animal fat can cause certain type of cancers. This we can avoid, and then practicing safer sex. Very important for young girls and adolescent girls nowadays. So when we practice safer sex, you can avoid genital tract infections, which are also again a reason for abnormal uterine bleeding. There are some things maintaining a good lifestyle. So remain physically active. Okay,
Okay.
at least do 30 to 40 minutes of brisk walking, and go for yoga, and having a nutritious, healthy, good diet is very important. Lifestyle, good lifestyle solves many of our problems. So I recommend good lifestyle for every woman. Very important because they
Okay.
don't take care of themselves. They don't have time to take care of
Yes,
themselves.
yes.
So every woman, very good lifestyle solves most of her problems, mentally, physically also.
Okay.
Yeah.
So, thank you, ma'am. It was great
Thank you,
discussion.
Bharti.
is any message from your side to our wonderful women regarding abnormal uterine bleeding or menstruation, whichever you want to?
So abnormal menstruation or abnormal uterine bleeding is a very common condition, what we see in our general OPDs. There is nothing to panic once you have an abnormal menstruation. Have an early checkup, okay? More important, what is more important is than to treat your acute bleeding is to evaluate the cause of the bleeding. Because sometimes like cancers and fibroids and all, they need an early management, and the many hormonal, non-hormonal, and non-invasive treatments are available. So never suffer in silence or be embarrassed. And when you consult a doctor, a simple lifestyle might change your menstrual pattern. So please do not hesitate to consult a doctor at the early insight and get an appropriate management.
Thank you so much, ma'am.
Welcome
Really,
back.
we discussed lot many about abnormal uterine bleeding, and it was a very wonderful session. Uh, Really, you helped us a lot by clearing all our doubts. So, whoever might be watching, they would have learned a lot about an awareness. You gave good awareness to our women. Thanks a lot.
Thank you, Bharti, and it was a good opportunity for me also to, and I thank you for me taking to the people, and really wanted to discuss some important topics because it creates awareness how to deal with these small things. As I said, it's one important topic where you should not think it is normal and you should not start living with these type of complaints. So please be in touch,
Yeah, thank you,
and
ma'am.
yeah, thank you so much.
Thank you so
Yeah.
much. Thank you.